Hello and welcome to week 2. So this week I've broken the lecture into 2 different sections. The first one is we'll be covering competence for you as the counselor. And for section 2, we're going to be covering ethics. So as we start moving into content for this semester and for this class, I want you to start thinking about who do you want to be as a psychotherapist. As you go through this class, what type of orientations stand out to you? What type of approach feels like it's a good fit for you? Start thinking about those types of things. So let's cover different therapist characteristics. These are factors that are in your textbook, and the author mentions things like having a sense of humor. And I think that it's true that having a sense of humor can be helpful, right? It adds life to things. We can take a situation that's maybe difficult and see the funny side of it. And that can be helpful as opposed to getting like really worked up about something. And so having that flexibility, that able to, maybe if you make a mistake, laugh at yourself and make light of things can definitely be helpful as a therapist. Staying curious about things, always questioning things, always questioning, well, what's going on here, or why is this occurring, or what's driving this behavior, is a really good mindset to take and to have when working with clients. And in line with that, that kind of feeds into being a lifelong learner where, it's not just a matter of, okay, I'm done with school and now I'm never going to be curious or never pick up a book again. It's more of always having this kind of mindset, if you will, around continually being curious, continually working on, okay, how do I better myself? How do I continue to better myself personally, but also how do I continue to better myself as a therapist to be able to provide the best service to my clients? And that will definitely include taking CEs, continuing to take courses or different, academic classes, that type of thing, to continue to develop yourself as a therapist. One of the big things that the textbook talked about was being authentic, and I think that this is important because clients seem to really know or be able to pick up on if you're being authentic or if you're not being true to yourself. And so being able to be authentic, I think will make you be a better therapist. Service in grad school, one of the factors that we talked about was, don't become a therapist if you're only in it to make money. And there is truth to that, because I think if you're only in it to make money, you won't be in it to really help the people that need help, right? You'll be focused on what's the bottom line. That being said, you can definitely make money in this field, right? Depending on what you're doing or what your specialty is, you can make 6 figures. So, I think it's a matter of focusing on the service and helping others, and then a byproduct of that is that you'll be able to, make money and live well. And along with that, there are plenty of jobs out there where you can probably, do less work or, not have to put in as much effort, right, in terms of like going and getting a master's or going and getting a doctorate or continuing to always be learning, where you can make good money without putting in all that effort. So if it's more about, I just want to make money, there are probably other job opportunities and options out there for you. I think we can probably all agree that sticking our heads in the sand is probably not the best way to handle a situation. And so we as therapists, I think, need to be able to have this ability to say, okay, I have made a mistake. Let me own that. Let me take responsibility for that, and be open about that, and be open to feedback and saying, okay, I'm going to own this. Now, how do I fix that? And I have done that in therapy sessions. Like, hey, you know what? I apologize. I just made an assumption about you, or I just made an assumption about this situation. Let me fix this, or let me rewind and back up. How do I need to be paying attention to you as the client? Or what do I need to change in this situation, from whatever this mistake is that I just said, whatever this, verbal blunder is that I just made. And being open to that. And when I work with clients, I will specifically start the relationship with saying, as part of doing the intake with the client, saying, I'm going to be asking for feedback because I can't read minds. That's not something that I was gifted with when I went to grad school. And so because I can't read minds, what do I need to be doing? How do I make sure that I'm working with you and maybe, that we're not working against each other, or that we're not on opposite pages. So I will start that relationship with saying that, and then that sets it up so that clients know that I'm going to be seeking feedback, or know that I'm going to be asking, how are we doing? Are we on the same page? Are we on different pages? I just want to check in and see where things are at. And then one of the things that we'll be discussing for the discussion post this week is, what are your strengths and how are you using your strengths, or how do you plan to use your strengths when you're working with a client? What does that look like? How will you leverage them? And then lastly, what I'll say about this is just characteristics in general, is that the textbook on page 19 and on page 20, the author has a list of personal characteristics that he believes are effective for counselors. And so do you agree with that list? Of course, some of the things that are on this slide are from that list, but there are also a lot of other characteristics that he put into the textbook. And so, are there other factors or other characteristics that you would add to that list, or would you prioritize the list differently from what he has listed there? Let me know in the comments below. What makes values so important, or why do they matter so much, especially in therapy? Well, our values are the factors that are important to us. They're the things that drive us, that drive our behaviors, our decisions. If you've got two values that are important to you, say religion and family as an example, if there's a situation where maybe there's a conflict in those values, how do you decide which one is a priority, or how do you decide which one comes first? So within therapy, one of the most important instruments is you, right? You're the person who's showing up, you're the therapist. And so how do you identify what your values are and how they might potentially impact therapy? So kind of going back to this example where I said, hey, you've got two values, one is family, one is religion. If someone else has a different value, say they really value adventure and they really value experiencing new things, their values are going to impact their behaviors and their decisions very differently from someone whose main values are God and religion and family. And so being open to self-exploration, being open to expanding your awareness not only of what your values are, but also how those values play a role in therapy is hugely important. Which is why it's one of the discussion questions for this week. So you've got some different questions there, just things to be thinking about as you explore what your values are. And you'll see the values discussion post in a couple slides. So if we're not careful, whatever our values are, they could potentially negatively impact therapy. And so this is especially important as different cultures occur or groups of people. We might hold different values. And so we want to make sure that we're being respectful and inclusive of everyone, especially if we're working with an individual who maybe comes from a different background or a different ethnicity, that type of thing. So again, identifying what our assumptions are, especially as they apply to diversity, culture, ethnicity, race, those types of things. We've got bracketing here. And so bracketing is setting our personal values aside so that they don't negatively impact therapy. And sometimes this can be really hard to do, especially because our values are part of what have created our worldview. Value imposition. So this is when the therapist directly attempts to define the client's values, attitudes, beliefs, and behaviors. Something that I've found in terms of bracketing and value imposition is sometimes I tend to get really worked up in therapy about certain things, whatever my values are. And so I've had to be really careful not to then impose those values onto the client. So for example, I was working with a mother a couple years ago in therapy, and she had two children, very young. They were toddlers. I believe they were twins, if I'm remembering correctly. And she would come to therapy and she would talk about, she's cooking, she's cleaning, she's got a full-time job, she's basically the primary caregiver of these two children, and her husband comes home and, they both work full-time. And her husband comes home and he would like play video games. And, my values are that there's equality in relationships. And so for me, I'm like, oh, hell no. Like, he needs to help out with the dishes and the kids and all these, right? All these things. And so I had to be really careful not to impose my values onto the client because she came from a different background. And so for her, there might not be that value of equality within relationships. Within her culture, that might be, hey, this is normal, right? For me as the woman in the relationship to take on all of these different responsibilities. So being very careful not to impose our values onto the client. And of course, we want to make sure that we're being open, inclusive. We talked about that already. And so that includes understanding the dynamics of different client backgrounds, different possibly discrimination or stereotypes that clients have experienced, and not only trying to understand those, but also making sure that we're not perpetuating those things within therapy. So these are a list of things that beginning therapists often struggle with, and I can tell you from a personal experience that I've made many of these blunders. So let's talk about a couple of these. So ambiguity, oftentimes therapy is like planting a seed for a tree. So you as the therapist might plant seeds, right? Like, all right, homework for this week for the client is to work on increasing mindfulness, or you as the client are saying that you're experiencing depression. Let's do X, Y, and Z to try and, work through that, decrease the the depression and help you feel better. But you as the therapist might not see the results of that. So you're planting these seeds, and then a month from now, 6 months from now, 2 years from now, that seed either might come to fruition, or someone else might water that seed, and maybe it grows a little bit and it grows a little bit as someone else waters that seed. And eventually, years down the road, that person has grown and developed into who they were trying to be through your therapy and working with you. But it's a work in progress, right? We're all works in progress. And so expecting a client to magically change over the course of, say, 6 months is highly unlikely. And so there is that kind of ambiguity or that lack of seeing, a lot of times lack of seeing the work that you've put in together, because a lot of times by the time that person is fully grown into who they're trying to become, it might be years and years down the road. And so sometimes that can be a little frustrating for therapists, especially younger therapists or novel therapists, is because you're not seeing the impact a lot of times of the work that you're doing with somebody. Countertransference. So this occurs when we are triggered emotionally, being reactive towards something that occurs within therapy or towards our clients, or we respond defensively towards our clients. And so this may result in us losing our ability to be present with our clients. So I've got an example of this. When I was on practicum, I was working with this individual and it's one of the only times that I've felt like really angry towards a client. He would come in, he wouldn't do his homework, he would just complain about whatever he had going on in life. He didn't seem to actually, from my perception, actually be working on anything. And so I felt extremely frustrated towards this guy, and it was something that I had to work on in my supervision sessions, discussing this patient or this client with my supervisor, and doing some self-exploration of, why do I feel this way towards this client? What is causing me to feel so frustrated and angry towards him when he presents in this way or when he says these things? Being open to silence is one of those things. Let's see, I skipped. All right, so being yourself, self-disclosure. We talked about authenticity already, but I think, and we'll talk about self-disclosure later in the semester. So self-disclosure is when you share something about yourself with the client. And so it's one of those things where sometimes we as young therapists maybe tend to overshare or self-disclose too much. And sometimes it can become one of those things of like, oh, that's what happened to you. Let me tell you about my experience, right? And then you end up making it about yourself instead of focusing and continue to focus on the client and whatever the client has going on. So self-disclosure can be helpful in therapy, but it's one of those things where you really want to be questioning and asking yourself before you make a self-disclosure, why am I going to share this with the client? Will this help the client move forward in their own journey, or am I making it about me when I'm sharing or considering sharing this information? Being open to silence is one of those things that I have sometimes struggled with, because it's one of those things where you're like, all right, well, I want to just break the silence. And then we end up just talking and filling that silence, where maybe the client, maybe they've just said something profound and they want to just kind of sit and think about it for a few seconds or a few minutes without you just like, all right, well, what's next? Let me talk and let me talk and let me talk. So that is definitely a skill that takes practice to learn. Self-doubt. So some of the rest of these things I'll actually talk about in the next slides. Imposter syndrome is, I think, one of those things that's important to talk about for a couple different reasons. One, it can occur, as research has shown, across the lifespan, and so that's what this research looks at. So constructivist grounded theory is a research method that focuses on generating new ideas through gathering information from participants, and then from gathering that information, they then create a theory as opposed to looking at a pre-existing theoretical framework. So what they did is they used semi-structured interviews and asked people a lot of different questions, got information. They looked at 28 physicians, so this is actually physicians, not psychotherapists, and they interviewed them about their experiences in underperforming as a physician. And so they collected all of this data, and participants, as they were going through the research, participants started talking about imposter syndrome. And so, the researchers, as part of this, continued and decided to explore this more in depth. And so what they found was that many participants, even individuals who are more advanced in their career, individuals who are maybe 10 years in, 15 years in, they still question, the validity of their achievements. They might still question the decisions that they've made. And so self-doubt still occurs even at later stages of someone's career. The difference between self-doubt and imposter syndrome is kind of at the end of that curve, if you will, or a higher or more serious level of self-doubt. So it's something that's much more pervasive than just, oh, I'm not sure if this is the right decision. So how that applies to us as therapists is because, we've talked about competence, and imposter syndrome is one of those things that even though you might fully be competent, you have the degree, you have the experience, you have the knowledge, you might still experience self-doubt, especially depending on what the situation is with the client, right? Here's an example. Anxiety, once you've treated, say, one person with anxiety, you've treated one person with anxiety, right? Once you've treated one person with depression, you've treated that individual. So just because you've treated that individual, that doesn't necessarily mean that you now automatically know how to treat every individual with anxiety or depression who walks through your door. And so even though you have experience that you can fall back on and you have research, you might still end up with someone who walks through your door who is depressed, but who has maybe something else going on, like a co-occurring diagnosis that you've never dealt with. And so even though you have experience, you have the degrees, there can still be these situations that arise where you as a therapist are like, oh, crap, what do I do in this situation? How do I handle this? And so that can create that self-doubt. And if it's something that you ruminate on, it can actually become much more of a problem and become imposter syndrome. Humor. So this is something that's in the textbook, as mentioned earlier. And humor can play a really important role in therapy, but it's also important to identify humor and when it's a distraction for the client and when they're using it as a distraction or kind of blowing things off almost. as opposed to when it enhances therapy and it is used in a therapeutic way. So it's really important to identify which one is going on there and how do you handle each of those, because they're kind of two very different situations. It's also important to identify and make sure that, kind of going back to that multicultural competence piece, to know when do you have enough rapport with your client to be able to use humor, as opposed to if you use humor and then it doesn't go the right way or it comes off the wrong way, and then it's like, oh, well, that's awkward, or now I've created this uncomfortable situation where maybe I just shouldn't use humor again. So really knowing your client is going to be a huge factor of whether or not you decide to use humor. I tend to not be a funny person in general. I don't think I tend to be much more serious. So a lot of times humor, and my humor is more kind of a sarcastic. So me trying to use humor often doesn't go well, and I just tend to avoid trying to use it in therapy. Giving advice, we've kind of already talked about talking too much, not allowing that space or that silence. Giving advice is one of those things that probably every new therapist makes this mistake. And it's something that we'll talk about a little bit more in motivational interviewing, so a little bit later in the semester. And there are situations where it's maybe okay to give advice, but for the most part, we want to steer away from doing that. Why is that? Well, there's a couple different reasons. One is our role as a therapist is, I would say, generally not to give advice, but more so to help the client explore for themselves and discover for themselves what their own solution is, or help them figure out how to problem solve and work through the problem in a way that they have the ball in their court, or they have the control, as opposed to us saying, have you tried this? Have you tried that? Let's try this. You can do, if you do X, Y, Z, it will fix your problem. The client probably already knows that, right? The client probably already knows I should eat more green salad in my diet. I should exercise more. They already know that, but they're still not doing it. So just telling them, go do this, go do that, is probably not going to be helpful. One, because it's not going to result in the change that's needed. Two, a lot of us have probably experienced situations where a family member or friend gives us advice, and how often do we go follow that advice? For example, my mom will call me, just kind of randomly and say, have you flossed your teeth today? Have you brushed your teeth? Make sure that you're brushing and flossing. You don't want dental issues when you get older. And I'm like, yes, thanks, Mom. I love you too. When my mom calls me and says that, do you think that I then go floss my teeth, or that I make sure to floss my teeth before bed? It hasn't resulted in my teeth flossing going up any more than it already would have or already is. And so a lot of times giving advice is not necessarily helpful, and it's oftentimes not really what the client needs in that moment. All right. Another example of when I gave advice and when I have given advice and it didn't work out was I was in grad school, so I'm like, oh yeah, I know some things. I'm in grad school. I'm a psychology student. And one of my friends was talking to me, she was in a relationship. She was dating this guy. She was really unhappy at the time. And so I was like, okay, I know all of these things. I basically told her like, hey, maybe you should break up with him because this seems like a really unhealthy relationship. And she came back and messaged me like a week later, and she was so mad at me, like, well, I told him that I think maybe we should break up, and he was really upset at me, and it kind of blew up in my face. And so then, she was upset at me, and it was a really good learning moment for me, to where I was like, all right, well, clearly I should not be giving advice about things that are, one, maybe not my wheelhouse, since relationships is not a factor. Couples is not an area of expertise or an area that I've ever really wanted to focus on in therapy. And two, I heard her side of things, and so there were probably a lot of other factors that I wasn't aware of or didn't know that were contributing to this situation. And had I known those things, maybe I would have given different advice. And so it was a really good learning experience for me to say, okay, I'm going to try to not give advice in therapy or to friends in general, and more so ask questions and stay curious. And through asking questions and through staying curious, figure out, all right, well, what will work for this person without me just giving advice? Because that doesn't seem to be very effective a lot of times. Within being a competent therapist, there are also factors that are at play in terms of how do we make sure that we're not burning out. And so self-care is a huge part of being a competent therapist, because we're making sure that within self-care that we're taking care of ourselves. I like this idea, or I like this quote of, you can't pour from an empty cup, right? So if your cup is empty, if you have nothing left to give, how are you going to be effective in your work with others? Or how are you going to really be able to be a good therapist? And so self-care is crucial in terms of refilling our cup, recharging ourselves, making sure that we're taking care of ourselves. And I don't think it's a luxury. I think it's a requirement in order to be not only a good therapist, but to make sure that we're not burning out, or to make sure that we're not providing like poor or unethical care. And this is covered more on page 34 of your textbook. As a therapist, the relationship in a lot of ways is one way, right? We're providing care to the client. We're providing all this energy and effort towards the client. That's not reciprocated, right? They're not taking care of us. That wouldn't be a therapeutic relationship, right? And so as part of that, we need to make sure that we're taking care of ourselves to continue to put that energy and effort towards the client. There are a lot of really good books out there about burnout. This is one that I read recently that I really liked, but there's a ton of other books out there that you could check out as well. Since we're talking about burnout, let's go ahead and look at some research. So the purpose of this study was to look at the level of work-related burnout and fatigue among psychotherapists working in clinical settings, and to investigate the relationship between burnout and personal related factors such as age, training, level of education, years in the profession, perceived competence, and other factors such as work-related factors, clinical setting. So for example, if you're in private practice versus if you work in the government as a therapist, or if you work in some type of corporate setting. And what was your satisfaction level with the work situation? And did you have access to a clinical supervisor? So they looked at all of this different data and information. What's important to know is that this study was done in Sweden. And so it's possible that due to different cultural factors, the results might not be as generalizable to other countries or to other therapeutic environments outside of Sweden. And so 327 psychotherapists completed the research. The Copenhagen Burnout Inventory was used, and this looks at fatigue and exhaustion. There are 19 items within the scale, and it looks at 3 different subcategories. So personal burnout, work-related burnout, and client-related burnout. And the scores are on a on a scale of 0 to 100, with 0 being, if you're scoring lower, you're going to have less burnout. If you're scoring higher, you're saying that you have higher levels of burnout. And so the inclusion criteria and exclusion criteria in this situation is kind of the same thing, because you basically had to either be working in some type of mental health setting or working with some type of psychiatric individuals, individuals who've been diagnosed with different DSM criteria such as depression, anxiety, those types of things. So if you don't work with that population or within a mental health setting, then you were excluded. If you did work in that type of setting or with those types of individuals, then you were included. Generalizability is one of the limitations that I've already discussed in terms of, because this was done in Sweden only, it might not be generalizable to the US or to China or other countries, or therapists who are working in those countries. And because the inventory is a self-report, sometimes when we're self-reporting, maybe we're biased, maybe we either say that things are worse than they really are, or maybe we say that they're not as bad as they really are. And so that can be one of the downsides of a self-report like this, is that sometimes the results can be a little biased. Future research. So something that this study is saying that could be done for future studies is to collect more data and consider other factors, like other types of data that they didn't gather. So for example, workload, like how many clients is one therapist carrying, right? Because a caseload of 10 is very different from a caseload of 50. Professional position. So for this research, they didn't look at what the position of the therapist is. So for example, is it someone who is just starting out and is maybe brand new to a practice versus someone who's 10 to 15 years in and maybe is in a supervisory role? Those two can be very different, and so that's something that can be looked at in terms of work-related burnout in psychotherapists. And they didn't look at role conflicts, so there's a possibility that role conflicts could maybe also impact work-related burnout. So the results, why do we care about this? Results and implications. So 62% reported of the psychotherapists that were in this study reported moderate or high levels of burnout, with significantly higher levels of personal and work-related burnout than client-related burnout. Competence ties into this. How? Well, psychotherapists who perceive that they have the competence to help patients are likely to feel less anxious and more work satisfaction. So that's really important to know. And why would I care about that as a therapist? Well, if I want to pay attention to, I as a therapist want to make sure that I'm paying attention to factors that contribute to burnout, right? So essentially what they found was that factors that contributed to higher level of burnout was being female, having low self-perceived competence, and working in the public sector were all associated with higher levels of burnout, which would be important to me as a therapist, especially if I'm someone who doesn't work in private practice, right? Because this is essentially saying if you work in, say, a government environment, or if you work in, say, a corporate environment as examples, you likely experience higher levels of burnout than someone who works in private practice. And there could be a whole bunch of different reasons that contribute to that, which is why they're saying, hey, future research is noted or needed. So really interesting research here. It's pretty cool. Self-awareness, I think we've kind of covered this over the course of this lecture. It's super important for a number of different reasons, right? Not only to be able to be more effective therapists, but also to be able to provide the most effective therapy possible to our clients, the best service possible. So part of that is, being open to or being willing to go to therapists ourselves. And I think that that's also hugely important, to be able to say, okay, I know that I as an individual have things to work on. So what can I do to work on those things? What can I do to increase that self-awareness? But also, how can I actually go change those things? And I think, if you're self-disclosing that to your clients, it can be a really good way to model that behavior. Like, hey, I'm a therapist and I'm also going to go see someone for therapy. It can be beneficial in terms of working on those interpersonal skills, where if you're someone who maybe has some things to work on, or you maybe come across a certain way to other individuals, it can be helpful to work on those interpersonal things. And that can then also be beneficial to therapy. As you improve, it's going to mean that you're providing better services to your clients. And then stressors, it can help us make sure that we're handling and managing our own stress, and not letting those things, whatever those personal factors are, bleed into therapy or negatively impact therapy, which is discussed in chapter 20, page 21 of your textbook. So what I really like is that as part of the introduction, you guys talked about hobbies or things that you like or things that you enjoy doing. And so all of those different hobbies or things that you enjoy doing are factors that basically make up self-care. We already talked about self-care. We already talked about we want to make sure that we're doing that we're recharging. And so what's a bonus here is that if you can do hobbies or self-care things that are maybe two birds in one stone type of thing. So for example, if you like being out in nature, taking a friend or a family member with you, like, hey, let's go for a walk together. Well, now you've got relationships and being in nature both happening at the same time. So that's definitely something to consider, and make sure that you're taking time to do those things that recharge you, that you enjoy. Whatever those hobbies are, whatever that self-care is. Therapeutic relationship. So I think we've kind of touched on this throughout the course of this lecture, just in the sense of, what are those factors, values, strengths that are going to be present in the room as a therapist, whether we're aware of them or whether we're paying attention to them or not. So therapeutic relationship, as you can see here in the slide, and a lot of research has been done around this, but I really like this graph because I think it's a nice visual. So therapeutic relationship is one of the biggest factors that contributes to whether or not someone changes or gets better in therapy. We've already talked about being authentic. We've already talked about some of those types of factors. And so, a big factor that I think maybe is not always necessarily clear as a therapist is that you're building this relationship with someone. You're working to come together with someone. And it's not all about, we're about to spend weeks and weeks focusing on different orientations, but it's not always about that. As this slide lays out, it's way more about who are you as a therapist and your ability to build a relationship with that individual. Clients spend less than 1% of their waking hours in therapy. So if a client is coming in 1 hour out of in a week, a week is 168 hours. So they're coming in for that 1 hour. And if they're seen bi-weekly or monthly, it's even less. So realistically, how much are they really going to be able to get better in that 1 hour out of all of these other hours that make up their life? So let's take a look at this graph a little bit more in detail. Extra therapeutic factors. So this is basically all of those things that make up the client's life in general: their environment, their support system, their strengths, their values, their what else? Their faith, their characteristics in terms of persistence or motivation, or all of those types of factors. That's what makes up 40% of this pie chart here. How they handle crisis situations, how involved they are with their community, whether that be friends, family, their church, their school. So much of that are factors that you have absolutely no control over. The relationship factor is the one thing that you do have some control over, right? Because you're part of this relationship. You're, I don't know, however you would break down that percentage, 50% of the pie, or, whatever that percentage comes out to in terms of an actual relationship. And I mean, I guess we've already talked about it in terms of you as the therapist are going to be putting way more work and effort into the client a lot of times than they're giving back to you. So it's definitely not a give and take relationship in the typical sense. Anyways, I digress there. So relationship factors. The relationship, this alliance or this, you guys coming together is what makes up the relationship. Or therapeutic alliance is what we often refer to it as. And so, as you can see, this makes up 30% of the graph. That's huge. And a lot of the factors that contribute to that, to you building a relationship with your client, are going to be things that are pretty, common sense, like being warm towards your client, showing empathy towards your client, showing encouragement and acceptance, those types of things. Listening to your client, letting your client know or letting them feel that they are listened to. Moving on. Expectancy. So this refers to the client, a lot of times clients come in hopeful and believing that treatment is credible, that they're actually going to get better. But, of course, if clients come in and they don't think, I've worked with clients who come in and they're like, I don't know that this is actually going to help me. I don't believe that this is actually going to help me. That also contributes to therapy, right? Because they have a belief that it either is going to help them or that it's not going to help them. And then you can see here that 15%, what we're going to be spending a lot of the rest of the semester on, only contributes 15% in terms of the therapeutic relationship or somebody actually improving in therapy. So that's different things like the models or the theories that we're going to be talking about, the techniques within those theories, different orientations, different strategies, different tactics in order to help the client move forward. So to me, this is fascinating because I think, as I've already mentioned, we're going to end up spending a whole lot of time for the rest of the semester talking about different orientations and techniques, but we also need to make sure and be really careful that we're not losing sight of that therapeutic relationship, because it does play such a huge part in whether or not a client improves over the course of treatment. So here are the discussion questions for this week. I will make sure to drop the links in the description below so that you guys can just click on it and be able to fill out the different surveys and questionnaires here. And then you'll be able to talk about the discussion in Canvas. These are my references. Please let me know if you guys have any questions, comments, or concerns, and I'll see you in the ethics lecture.